That's a really important thing to talk about when you talk about facial resurfacing. You have to weigh the balance of downtime versus results. So, we go through ebb and flow, and at one point everybody wanted minimal downtime. They want maximum results, minimal downtime. Well, you want to go in and have a procedure and come out looking pink and be able to go back to work the next day. You're going to have to do that a lot to get any results in there. If you go in and have an ablative procedure done, and we'll talk a little bit about ablative, non-ablative lasers general, but if you go and have ablative, you look horrible for a while, but then you're going to have more dramatic results on the other side. And both are great treatment options based on your life. If you're a professional and you can't take time off of work, doing, the BBLs and the IPLs on a regular basis, have that. But it is time consuming. I think it's hard for me as a surgeon. I just don't have, when I'm seeing other patients and doing surgery and things like that, I don't necessarily have the time to do, 10 procedures on a patient to see where they are. So I tend definitely in my practice to stay on I do more the ablative work. So non-ablative are more of those minimal downtime procedures. They're the procedures that don't necessarily, kind of totally, injure or traumatize the tissue. It just kind of has a small focus. So you have less of a recovery time. The ablative procedures means it actually goes through and actually does, you cause thermal injury or remove, cells from the top. So it's more of a traumatic event, a controlled traumatic event that we can predict the healing, but you get much more dramatic, results from ablative procedures. So if you want to see big changes, especially things like acne scarring or really heavy wrinkles, you need to actually do an ablative procedure. So every laser has a role based on what you want.